So having breast reconstruction was important to me because at the time I was only 37. I was technically single. I wasn't married. I was fresh out of a divorce, and it was a very personal decision for me. It wasn't about my partner at the time or a future partner. It was just about how I would feel in my own body and how I would look in my clothes. And on the other side of cancer, I just wanted to look as much like the old me as possible. My first visit with my plastic surgeon was really, really positive. I met with a nurse navigator first, and who coordinated the surgery schedule between my breast surgeon and my plastic surgeon. And I spent about 45 minutes to an hour with her, really talking about post-op and recovery and what my needs would be and what the experience would be like going through the day of surgery and being hospitalized for the day after and all of that. And then I met with my plastic surgeon, who is a woman. It felt really good in a weird way. I just needed something to feel good about going into the operating room that day. So my plastic surgeon really helped decide on which implant would make the most sense for me. And we talked about a lot of different options, but she explained like all of the technicalities about the different implant options and what would be a good option for me. Like the profile of the implant, things that were so foreign to me. And so she explained why, she wanted to place a cohesive gel implant or a high profile implant. Like these are all words she was using right then and there at the visit, and explaining like, just comparing what an implant might look like compared to my natural breast and how it would sit in my body. Discussing like the difference in the feel of an implant. And so that's really how we came to that decision. We came to that decision together, my plastic surgeon and I. Today, I truly know how incredibly resilient I am. I am more than just surviving in this life. I'm thriving, and I hate to sound cliche, but I would have never imagined that on the other side of all of the things that I've been through, that I would be helping people or turning something that was so potentially painful and earth-shattering for me into something that is really, for me, really beautiful and really empowering. So my favorite piece of advice is to just take things one step at a time. And everything, right? One surgery at a time, one procedure at a time, one treatment at a time. It's very easy to get caught up in wanting to rush all the way to the end and wanting to hurry up and be on the other side of it. But there's so many things to consider, so many things to get through, that my best piece of advice would be to just take it one step at a time.
Natrelle Breast Implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example lupus and scleroderma; a weakened immune system, example taking medications to decrease the body's immune response; planned chemotherapy or radiation therapy following breast implant placement; conditions or medications that interfere with wound healing and blood clotting; reduced blood supply to breast tissue; clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.